Hello, everyone. We are live. This is Bob Miglani. How are you? I'm wearing a turtleneck. It's cold. It's cold. It's freezing. It's November 6th and it's cold outside. And okay, it's not freezing, but it's cold. And so I want to welcome you all. We're doing a live stream today. We're going to be talking. Can you hear me okay, by the way? If you can hear me okay, give me a thumbs up and say hello, how are you, and tell me where you're calling from and why you're here. Why are you here? You're here because I speak so well, or you want to learn something, you want to get inspiration, you want to get instruction. What we're going to do today is really focus on a specialty practice called dry eye disease. Okay, and we're going to talk about dry eyes and what works and what does not work for dry eyes. Okay, in particular, we're going to talk about handling objections. Okay, team, let me know. Team, let me know if the LinkedIn is working, if the Facebook is working and we're streaming everywhere. If it's not, let me know. Okay. Because we can fix it. We want to make sure we're giving massive value to everyone joining this live stream today. We're going to learn. If you're here, you're at the right place. If you're a doctor, you're an optometrist, you're an ophthalmologist, and you want to do more dry eye, because guess what? It's a moneymaker. Okay. Patients certainly have a problem. You need it. But it also is a very important revenue stream and high profit margin for your business. The volume of dry eye patients today is pretty incredible. A lot of new patients have dry eyes, and we need to make sure that they get served appropriately, they get value. And one of the ways we do that is by talking about the treatments. But a lot of times patients have objections. Doc, it's too expensive. I can't do your IPL RF treatment. Doc or staff, they tell you, they tell you, I can't do it. I don't want to do it. It's too expensive. It's not what I came in for. I came in for an eye exam and glasses. And so how do you talk to patients? How do you engage patients in a thoughtful way that allows them to, number one, get educated, and two, is to make sure that they are getting the treatment that they need, right? To get educated, they sign up. That's kind of our goal. All right, so let's get started. First of all, everybody's seeing this okay? Everybody's not seeing this? Any questions that you have, drop them in the chat. I want to make sure that we're offering you value here. So I want to make sure that you're seeing everything that you possibly can see, and that you have the ability to ask questions. The chat is open, so making sure that you're seeing all of this, and we're going to move forward. Okay, all right. Let me share my screen here. I'm going to present my screen. I'm going to share with you some important things to think about. Okay, so let me open this up. Let me share my screen here for you so that you can see this. All right, so let's go. Let's get started here. All right, let's talk about. We're going to talk about. We're going to talk about dry eyes. Yes, of course we are talking about dry eyes today. Of course we are. Don't be silly. All right, dry eye objections. Dry eye objections. Here we go. Where is it? I can't find it. For some reason, I can't find my screen. Here it is, folks. Okay. All right. We're going to see it. Now. Now, can you see my screen okay? The answer should be yes, Bob. I can see your screen okay. All right. First thing, let's talk about the objections. Let's talk about objections, right? So some of the big objections patients have, okay, is it's too expensive. It's too expensive. Okay. My eyes don't feel dry. Why can't I use drops? Do I really need to do this? What's the big deal, doc? And then how am I going to know that the treatment you're giving me for dry eyes, an IPL, intense pulse light, RF, okay, LLLT, light therapy, okay, drops, or other treatments and procedures that you're giving patients, punctal plugs. How do I know this is working? So these are some of the objections patients ask. But the truth is, patients really don't give you objections. They just don't show up. They're quiet. They don't sign up. And they mention price as a major objection, which basically means you haven't demonstrated to them value. You haven't given them value. And that is why they haven't signed up. So the truth is, most patients will not give you an objection. They will just run away. They'll ghost you. Okay. And they will not sign up with you. And then you're thinking, well, my problem is price. I'm pricing it too high. And then you lower the price and you lower the price and you lower the price and you try some things new and they don't sign up. And then you kind of give up on the IPL or the RF treatment for dry eyes. And then guess what happens then? You're frustrated. The mortgage sits heavily on your shoulders and you're like, I don't want to do this anymore. And so we've been there. We've been in this position. We've seen this practice after practice after practice. I saw it in my wife's optometry practice. I also saw this in a consultation I did recently with a dentist. I went for a veneer consultation. I have tetracycline stains on my teeth. I was born in another country, in India. And when I was very young, I had pneumonia. And those days in the 70s, they gave antibiotics to children. We were born in a little village in the middle of nowhere. And they gave me tetracycline. And it saved me. It's a good antibiotic, but it saved me. But it stained my teeth, okay? And permanently, like permanent, teeth stains all over. And they're so hard, you can't just use whitening. So my wife says to me, go for a consultation every few years. She says, go get veneers or something. And I said, okay, fine, I'll go. So I went to a consultation and it was a really, really good dentist in our neighborhood. It's a beautiful place, granite counters everywhere. Everything was beautiful, high end. Tech was great. So then he spends about 25, 30 minutes with me, an evaluation, veneers evaluation. It was a free evaluation. He showed me a book. And then the treatment coordinator, I asked him one or two questions. It was like 6 p.m. on a Thursday night. And then I go to the treatment plan coordinator, and the treatment plan coordinator gives me the treatment plan. They call it a treatment plan. Okay, this is a dentistry place. So the treatment plan is for $33,000. $33,000. I was like, man, I'm in the wrong business. And then I said to myself, either I could pay for my college tuition for my child. Okay, a little bit of college tuition because college is expensive, outrageously expensive. But, I could pay for college tuition or get my teeth done. And then they give me a discount price, $25,000, and ask me for my signature. This is a treatment plan penciled in with some numbers, okay, and a date. This was in July, actually. This was a few months ago, right? July. And I got home and I had all these questions. Then I got home and my wife, who is an optometrist, an eye doctor, Chevalier, had all these questions. And she's like, what about this? What about this? And I'm like, I'm an idiot. I'm not that smart. I didn't know what to ask. So I didn't ask those questions to the doctor. And so she asked, as healthcare decisions are made in the kitchen, typically with your spouse or a loved one. And you brainstorm back and forth, like what happened, this will happen, and you kind of collaborate with somebody else. And guess what happened? Okay, she asked me questions, I didn't have the answers, and I never showed back up to the doctor's office. In fact, worse, they didn't call me. The dentist who presented me with the veneers consultation treatment plan never, ever called me. Never texted, never emailed, no FAQs, no brochures, no handouts. Nada, zip, nothing. Nothing. Okay, nothing. They gave me nothing. And they gave me an invoice for $33,000. Nice guy. Terrible, terrible businessman. Terrible at business. And I say terrible because today you've got to be outstanding in business. You can no longer be mediocre. It does not work. Okay? You've got to step up. And you should have given me some videos or some content to answer hesitation questions at home. That's what should have been done. And it was not. And I will not go to that dentist for veneers. Okay? I'm going to look around. Obviously, the shopping around, this happens, so it causes issue. But truly is why patients sign up for treatments, okay? I tell you that example for your dry eye business because the reason patients sign up is three things. They like you, they trust you, they believe you're an expert at solving the problem that they have. They like you, nice guy, trust you. Can I trust him? Can I trust her? I'm going to get into how you can get trusted, okay? And then, is he an expert? Well, he had before and after cases. So he looked like he was an expert, but I don't know really if he's an expert. Like, how am I going to know? I don't have time to go on YouTube to look him up. I don't have time to do any of that. And his website's going to say great things. So, but how can you show that you're an expert? And so here's how you do it. How do we demonstrate trust, expertise, and likability? And I'm going to go to those questions, those objections you came to learn about. You came to learn about objections for dry eyes. I'm going to go into that. But I want to share with you something very, very important. You've got to demonstrate trust, expertise, and likability. And you do it in 4 important ways. And then we're going to talk about those objections. Number 1, you've got to use clinical proof. You've got to use evidence, a scan, an x-ray, a blood test, something objective. You cannot sell in the first visit. No one closes, okay, in the first visit. It's very, very hard to convince anyone to fork over $33,000, or in your case, you're an optometrist and you're doing dry eyes, IPL, RFs, or an ophthalmologist, and you're doing dry eyes treatment, and it's about $1,600 or maybe $3,000, okay? $1,600 to $2,000, $3,000 for treatments. In mode, probably $2,200, $2,500 for Envision in mode. For dry eyes, IPL, RF combo, something like $2,500, $3,000. Who's going to pay for that in the first visit? Okay, right? Only if you're like, in a very lucrative area. People are just going to write you a check, or here's my credit card, ping me. I'll pay for it. I'm ready to roll. It doesn't happen. So don't sell. Don't overly be pushy in the first visit. Okay, and a lot of doctors don't want to be salesy, but they find themselves trying to oversell the IPL, the treatment, in the first visit. Don't do that. Does not work. Doesn't demonstrate trust, expertise, and likability. Third, proactively answer those hesitation questions. You've got to be proactive at answering the objections before your patients say it out loud. Let me stop. When a doctor looks at me and sees that I've got questions on my mind, and says to me, I believe this is what you're wondering, and here's the answer to what you might be wondering, Bob. I am looking at her and I'm saying, man, she's really good at this. She's a pro. She's heard this question before, or she knows what I'm thinking. And that's what I mean by proactively answering questions in their head. They hesitate. I'm not going to say it to my doctor because I respect her or him, right? I don't want to talk like money. I don't want to sound dirty, but I don't want to say it to the doctor. I might say it to the staff. So you've got to be proactive, and you've got to answer those questions proactively. Use visuals and videos to educate and to be seen as an expert. Okay, so that's how you demonstrate trust, expertise, and likability. All right. By the way, any questions so far? I want to make sure that we're answering questions. Amanda, let me know if we have questions here. I'm waiting for any questions. Or do you like this? Does it make sense? Is it making sense to you? Okay, let me know. Tag me, questions, just comment, show me a thumbs up, give me some love. All right, so let's get into some of the reasons, the ways you can handle those objections. One way you can handle objections, have a real clear process. Okay, and what I mean by process is you've got to really do meibography on every single adult comprehensive exam for your dry eye. It does not work just on symptoms alone. It doesn't work when you dry eyes with IPL and RF or other treatment procedures that you've got. You cannot rely solely on the symptoms. Your market is going to be this small. You really have got to open the funnel and do a proper diagnosis using clinical objective proof. And that's the meibography. You can't guess who has gland loss and who does not. You have to make it standard of care. Raise the standards, folks. Do the x-ray, do the blood test, do what it takes to demonstrate clinical proof that something is going on, because everyone wants that today. Everyone suspects you're trying to sell them something. The big word of the day is sus. Sus. Like what? Like I'm suspecting you're selling me something. Like stop. Okay. So you need to do a meibography. Then we're going to walk you through the 3 hats talk track script. And then you bring them back for an ocular surface evaluation. And you do the 3 hats talk script. And then you get them to sign up. Or if they don't sign up, you nurture them. Okay. So let's walk through kind of what that looks like in the clinic, in the comprehensive exam. You're going to wear 3 hats: the doctor hat, the educator hat, the mind reader hat. This is really important. Really important. Okay. This is what we teach at Hoot, all our members. And we teach them these 3 hats. We give them a script, regardless if it's dry eyes, myopia, cataract surgery, foot and ankle surgery, implants for dentists, cosmetics. You've got to wear the 3 hats. Doctor hat number 1 for dry eyes. Let's go through it. Mr. Jones, I suspect you have dry eyes or something we call meibomian gland dysfunction based on the findings of the scan that we did today. It's concerning to me. It could be a problem if we don't do something about it, and it could lead to further deterioration. Now let's educate you. You shift and you're like, what just happened? Okay. So what you want to say is we did a scan of your eyelids today. Okay. We did lower lid scan of the meibography. We found something that concerns me. Could be a problem if we don't do something about it. So that's the doctor hat. Now let me educate you. Because we're on screens more than ever, okay, we're not blinking enough. And we don't blink enough. These mini beautiful tubes that you have in your eyes, in your lower and upper lids, they're not pumping beautiful, healthy oil that covers your eyes. So screens and other factors are to blame for more and more cases of dry eyes in patients like yourself who have this thing called possibly meibomian gland dysfunction. I'm going to educate you. Here's a piece of paper. It's a handout. I'm going to send you 4 videos over the next week or so. Please watch them. They're coming from me. We use an educational service called Hoot. They're going to send you the videos at home, and I want you to watch them. And then I want you to book an ocular surface evaluation in about a week and come back and see me, do some more tests. Okay? It's really important. Thank you. That's it. That's the educator hat. Now you move to the mind reader hat. This is where you answer objections proactively. I'm going to walk you through 3 very important objections, and then we're going to stop and we'll do a quick Q&A. Objection 1. So basically the mind reader hat, their patient might be sitting there and be like, what's going on, right? And so they may not say anything. They might be like, okay, thank you. And then they just leave, and they don't book, and they don't follow up. They don't read. They don't do anything. They ghost you, complete ghosting, okay? It's because you're a good doctor. You told them the diagnosis. You educated them a little bit, okay? You told them why something is happening, really important, why this is happening. You didn't talk treatment. You didn't mention anything about IPL, RF, or drops or anything, right? So you just diagnosed the problem. It's really important to demonstrate trust, okay? And then the mind reader has where you handle those pre-op. So you're going to say this to them. You're going to put the mind reader hat on. You're going to say, Mr. Jones, you're probably wondering, Doc, I just came in for an eye exam and glasses. My eyes don't feel dry. What is this thing called dry eye disease? Like, what is this? Okay? That's what they're thinking. They came in for an eye exam and glasses, and you told them about that you've got something, and they're like, what? I don't feel it. I don't feel it. I don't feel dry. My eyes don't feel dry. Okay? So this is what you have to say it. You have to bring their objections out of their head, put it on the table, and then answer it. You're right, Mr. Jones. Your eyes don't feel dry. You may not feel dry or may not feel the symptoms until it's often too late. Just like other conditions like high blood pressure, high cholesterol, diabetes, glaucoma, we don't feel the symptoms often until it's too late. Okay? We all know someone who was feeling just fine but had a heart condition. Okay? And we only discover disease today is often very silent and invisible. We don't see it, we don't feel it, but we detect it on a blood test, an x-ray, or a scan that we did, like the meibography of your eyelids this morning. Does that make sense? So you're right, you won't feel it until it's often too late. You have to go affirmative. See that? So you handle the objection proactively. Okay, proactively you handle the objection. You brought it up yourself and you put it on the table. Because otherwise they're afraid of you. They're afraid to ask these questions. Like, I don't feel right. I'm out of here, right? But what we want to do is want to make sure in their head it's not making sense to them. The mind is a sense-making machine, and it requires you to help them make sense of things. It doesn't make sense. They don't have symptoms. So you've got to explain it to them, okay? And the way you do it is do it proactively. If you do it proactively, you're more likely to be seen as an expert, okay? So it's really important that you educate them there about the fact that they don't feel the symptoms. Second, Mr. Jones, you're probably wondering, Doc, why can't I use drops? If I feel symptom, itching, burning, redness, the dry eye symptoms, I'll just go to CVS and get drops. You're right, Mr. Jones. If that's what you're thinking, you're wondering, you're right. Drops can be helpful for giving you symptomatic relief, but they don't get to the root of the problem, which is your glands are clogged with hardened oil. Glands are deteriorating. This is about inflammation, Mr. Jones. It's not just about the symptoms, symptomatic relief. You have to get to the root of the problem, okay? Which is you're not blinking enough and that oil inside is getting hardened, okay? It's getting hardened. And that's really terrible. It's not good because once your glands are gone, they're gone forever, okay? So does that make sense, Mr. Jones? Yes, doctor. Then the third, okay? Mr. Jones, you're probably wondering, Doc, why do I got to come back? Why do I have to come back? It's like a whole thing. I got to come back. It's like a visit next week. I got to take time out and come back again. And we have to come back. I came in. I had no problems. Now you're telling me you got something, and now you want me to come back. Mr. Jones, you're right. Everyone's lives today are really busy. And I want to be respectful of your time and certainly our time here in our practice. And I can tell you is that, you came in and, today the world has changed. We're all on our devices more so than ever. Your image of your glands showed that something is wrong. And and this is likely because of increased screen time, lack of blinking, other factors, certainly, environmental conditions, other medications, for example, chemotherapy, antidepressants, and other things. And I really want to get to the root of the problem and figure out what's going on. So today the world has changed, and your scan showed something is wrong. I want to investigate this further, and also educate you about what it is and what the problems are and what treatments can be done about it. Okay, so you get those videos at home from me, but I really would like you to come back in about a week. It's about half an hour appointment, and it's mostly covered by insurance. So we're good there, and I'll see you in about a week if that's okay. I wouldn't be doing myself as a good job as your doctor if I didn't ask you to come back based on the scan that we had done today. I did today on you. So does that make sense, Mr. Jones? Yes, doctor. What you just did is to proactively answer objections before they asked. And what that does is it completely changes the game for you. It completely changes the game. What it does is it helps you realize that number one, let me stop sharing here. Number one, it really helps you understand, help the patient understand that they found something, you're concerned about it, you're a good doctor, you're trustworthy, and you're not pushing or trying to sell an IPL or FR treatment. You're just making the diagnosis and you're educating the patient about the problem, okay? When you start talking about the solution, it's a selfish interest. So don't talk about it. Patients and doctors often go from problem to solution, problem to solution, problem to solution. I know that's what you're trained for. But patients today don't understand why. Why is this happening? What's the big deal? They want those answers. And if you leave them alone, they're going to get it from TikTok, ChatGPT, or whatever, or they may not even care. It's an invisible disease. They don't see the symptoms. So if they don't see the symptoms and they don't show back up, then you've lost that patient, poor health outcomes, and no revenue for you. So it's a loss versus you educate them thoughtfully. It becomes a win-win for the patient and for your practices as profitability and growth. Okay. So the way you handle those objections is proactive. Be proactive and use the phrase, "You're probably wondering," insert objection here. Okay. You're probably wondering, "Doc, my eyes don't feel dry. Why do I need to do anything?" Right? You're probably wondering, "Why can't I use drops?" Doc, you're probably, Mr. Jones, you're probably wondering, "Doc, how come insurance doesn't cover it and how much is it?" And Mr. Jones, the answer is insurance doesn't cover it because insurance plans have yet to catch up to reimbursing treatments for problems that just started happening the last 10 years, especially since COVID. We've been on screens more so than ever. And it takes insurance plans time to cover it. Sometimes they do, sometimes they don't. Remember, it took them 20 years to cover mammograms. It took them a long time to cover it in many places. So the point here is that insurance doesn't cover it for all these reasons. And the fee is nominal. It's not $10,000 of like stem cell therapy or regenerative therapy or peptides or whatever GLPs, you might be thinking about. It's about $400 for 4 sessions, something like that. And so it's about $1,600. And then when you say that, and you have to just say it. Most doctors are so afraid of presenting fees, but do it in a thoughtful way. You got to say something, because then you're hiding it almost, and you're waiting for your staff to say it. And a staff are sometimes not good at it. It's variable. So what you must do is to just say it. Say, you know what, insurance doesn't cover for these reasons. You're the authority figure, for crying out loud, as a doctor. Okay, wear the white coat. Okay, yes, wear the white coat. I know it's a hassle. You don't like it, but tough luck. Tough noogies. You got to wear the white coat. Wear the white coat. Show some authority. Show some science. Show trust. Demonstrate trust. Okay. And then what you do is you want to make sure you're thoughtfully answering proactively that cost question. And then you can give it to say, you know what, Jane here or Tom here at the front desk can tell you a little bit more about the fees and the programs that we have for payments and things like that. Okay. But I want to see you next week. Reduce some screen time, please. Stop watching phones, and the dinner table. Maybe just watch the TV instead. Go outside, blink a little bit more. It's not going to go away just like that, but it's really important that you start taking better care of your eyes that way. Okay. All right. Thank you. And promise you're going to watch those videos. Okay. Yes, doctor. Yes. When you make patients promise you something, they keep it, because people don't like to call themselves liars. When you make a patient promise you something, they like to keep their promise. So make them promise something. Okay? Mr. Jones, please do me a favor. Promise me you're going to reduce your screen time. Right? Just like look up every once in a while, blink. Promise me I'll see you in a week for that visit. Promise me you're going to watch the videos that we're going to send you. Okay? I don't want to just waste my time. Promise me you're going to do it. All right? It's important. Yes, doctor. I promise. Oh, man, gold. Okay, let's wrap up. First of all, any questions? Any questions that are coming? Yes, I see a question here. The question is, how do you handle the objection that says, how will I know this worked? How will I know the treatment worked? And that's a great, very good objection. A lot of doctors. So first of all, you didn't mention treatment in the comprehensive. Typically in the ocular surface evaluation, you're going to mention the question, and they're going to you're going to mention the treatment, and therefore that question or that objection comes up in that second visit. Remember, that second visit is where you get into treatment. The first visit, only about the problem. The second visit, problem and solution. Okay? That's the way to think about it. You can't close in the first visit. You can't. It's too much. It's overwhelming. Patients won't make a decision about that because they have to talk to somebody at home, right? So the answer to that question is, the question was, how do I know if this is effective or not? And the answer is sometimes we'll do a scan again, and sometimes it takes a little while, it takes several months to see the changes in terms of how you feel, but also on the scan, you could see some changes. And the goal is not for your glands to grow back all of a sudden. It's to keep the ones you have. It's to keep the ones you have from further deterioration and atrophy. Okay. So what we're trying to do is to control the loss. Okay. You can't grow them back. Glands don't grow back overnight. They don't. So what you must do is you have to articulate. So that's the way I would handle that question, that objection, which is that, look, we'll know in a couple of different ways. One, we're going to know in terms of how you feel. It might be 3 or 4 treatments in, you might feel differently. That's number one. So feeling is important. But really, the scan is very helpful. So the scan will show us maybe on some lid margins, we'll see some changes. So also in expression, we'll see some changes when we express. The oil that comes out is a different color, so we'll know that. So there's different ways to know how you're going to change, and the treatment is going to be helpful to you. But the bottom line is it's not an overnight solution. Your glands didn't deteriorate overnight, and therefore they're not going to be fixed overnight. And there's no fixing. This really is preserving the ones you have. And once they're gone, if they're gone forever. They're not like starfish. My friend Todd Cohen, Dr. Cohen says, they're not like starfish. They don't grow back. Once they're gone, they're gone forever. So what we must do is preserve them. Does that make sense, Mr. Jones? Yes, doctor. See, that's the way you handle the objection. Okay. So does that make sense? Has this been useful to you? Has this training been helpful to you? Any other questions do we have? What do you say to a patient that asks about price during the comprehensive exam? Great question. Thank you for that. So the question is, how do you handle a question when a patient says, what's the price, doc? Well, first of all, you haven't decided, you haven't mentioned treatment. You haven't mentioned treatment. Okay. So there's really no price should not be coming up in the comprehensive exam. And the way I would do it is, look, Mr. Jones, I understand you're interested in seeing what the treatment prices could be or fees could be. I don't want to get there right now. I really need to do some more testing to better understand what is going on with the problem. I want to identify why this is happening, what is going on, how severe it is, if it's moderate, mild, or severe, and then figure out what the right plan for you might be. Plan for you might be just do blinking exercises. Plan for you might be do drops or compresses, or maybe some omega-3s, or an IPL or RF treatment. So depends on. I don't want to mislead you. So, but the bottom line is, depending on the different treatments, the price varies from $500 to $5,000. Okay, but typically a couple of these procedures that we have in our office, if we decide to go in that direction, is about $400 for about 4 treatments. So but I don't want to go there right now. I think what's really important is the problem and really understanding the problem better. And that's why I need you to come back and look at it. We might not do anything depending on the stage of the journey you're in. Does that make sense, Mr. Jones? So what you've done here is you have to believe that as a doctor, even though I know at the heart of hearts you want to get the IPL sold, you want to sell, you want to be able to get the sign up, right? But you don't want to be pushy. You don't want to be pushy. You don't want to seem like that's all you care about. You want to let them know, hey, I care about you, your problem, not my solution. And that's how you build trust. Trust is the cornerstone of every relationship, especially the one between the doctor and their patient. And the way you generate trust is you focus more on the problem than your solution. And the way you focus more on a problem is like, hey, I really want to just figure out what's going on, and we'll work at this together. I need you to do some screen time. I need you to do some of these exercises, and then we'll see you back and we'll talk about treatments. Okay. I don't want to go down the road of treatments because I don't know which one I'm going to go with for you. I might be a mix of things. Okay. And so that's the way I would handle that question. Hopefully that was helpful. Justin, thank you for asking that question. All right. Let's wrap up. Okay, dry eyes and objections. I hope this was helpful. Three things I want you to remember. Remember, trust is the number one most important thing between a doctor and a patient. Trust, and the way you get that is, number two is education. You've got to educate them. You've got to educate patients, okay? And you've got to do it over a course of a journey. You can't just do it in one visit, okay? And the third most important thing is in objections is do it proactively. Okay, patients are not going to verbalize it for you. They don't know like exactly what to ask a lot of times. They're going to just raise price as an objection. So what you've got to do is you've got to bring those objections from their head onto the table and address them proactively. And that's called being a mind reader. You got to put the mind reader hat on, okay? So I hope this is helpful to you. Let's, Amanda and Justin, whoever it is there, let's put the link for Hoot. So gethoot.com is our website. I want you to go to it and I want you to go and book a demo. If you're a clinic that does dry eyes, okay, and you have an IPL and RF, it's sitting there gathering dust, call me. It's really important that you do something about it to start generating that revenue, okay, and helping more patients. All right, folks, I'm out of here. Thank you very much for your time. I hope this has been helpful. Give me a thumbs up, a like, a comment, or a share. And I look forward to seeing you soon. Thank you very much, everybody. Bye-bye. Bye-bye.